When it comes to health and elevated blood sugar levels, most people usually associate this with diabetes as the main issue. However, before receiving an official diagnosis, the body sends warning signals about high blood sugar levels that should not be ignored. Consumption of artificial and processed foods contributes significantly to the increase in the number of people with high blood sugar levels. To effectively address this issue, it is necessary to train oneself to recognize and respond to the signals our body sends. These simple actions will help maintain optimal health. There are two main types of diabetes. The first type is insulin-dependent diabetes or type 1 diabetes, which arises from a malfunction of the pancreas, reducing insulin production. This condition impairs carbohydrate metabolism, leading to insufficient absorption of glucose by the body and muscles, which can result in rapid weight loss. Type 1 diabetes often occurs in individuals under 30 years of age. The second type is non-insulin dependent diabetes or type 2 diabetes. This form is caused by reduced tissue sensitivity to insulin. Despite the blood insulin level being normal, low, or high, obesity is a leading factor in the development of type 2 diabetes, which is more common in individuals over 30 years old. There are other, less common types of diabetes. Diabetes can cause complications, including a weakened immune system, which can hinder a person's recovery from illnesses and lead to chronic diseases. Wound healing can also be impaired. Diabetes can damage nerves and blood vessels, increasing the risk of developing atherosclerosis and affecting blood vessels in the eyes, kidneys, and skin. All of these problems can contribute to the development of a complex set of complications known as diabetic foot syndrome, which can lead to inflammation, ulcers, and tissue necrosis of the foot. In severe cases, amputation may be necessary. This is why it's important to be aware of the early signs of diabetes and be able to recognize them. Early detection and treatment of diabetes can help prevent or delay the onset of serious complications associated with the condition. If diabetes is left untreated, it can lead to damage to various organs and organ systems such as the heart, kidneys, eyes, and nerves. Therefore, by recognizing the early signs of diabetes, individuals can seek medical attention and receive proper treatment, which may include lifestyle changes and medication. This can help control blood sugar levels, prevent complications, and improve the overall quality of life for people with diabetes. The first sign not to ignore is excessive nighttime urination. Drinking a large amount of water before sleep can lead to frequent urination during the night. However, when blood sugar levels are excessively elevated, the likelihood of developing urinary tract infections increases, leading to increased urination. The second symptom of high blood sugar levels is temporary blurred vision. The third sign is difficulty concentrating due to insulin deficiency, which hinders the transport of glucose from the bloodstream to cells, leading to fatigue and poor concentration. High blood sugar levels can cause dehydration as the body tries to eliminate excess glucose through urine. The fourth symptom is dry mouth, which arises from high levels of glucose in the blood and saliva. The fifth sign is erectile dysfunction. This issue affects only males and is a result of poor control of blood sugar levels over an extended period. Nerves and blood vessels can be affected by high blood glucose levels. The sixth sign is frequent infections. It's important to monitor recurring infections and check the condition of the pancreas and blood glucose levels. The seventh sign of high blood sugar is slow wound healing. If you've noticed that minor cuts and bruises take longer to heal than usual, it may be due to elevated blood sugar levels. High blood sugar affects nerves and can lead to circulatory issues, hindering blood access to the skin and its recovery in the damaged area. The eighth sign of stomach problems is high blood sugar levels, which can lead to slower digestion. This can result in bloating, heartburn, abdominal pain, nausea, or vomiting. The ninth sign of high blood sugar is a constant feeling of weakness or extreme fatigue, possibly linked to inadequate thyroid activity. Battling infections also demand energy, contributing to persistent fatigue and high blood sugar levels. The 10th sign is thirst, caused by kidneys working overtime to filter and absorb excess sugar to maintain fluid balance in the body. The 11th sign is dry and itchy skin. Poor circulation triggers body itchiness, especially noticeable in the lower body. The 12th sign is a continuous sense of hunger. While a healthy appetite is normal for some, those who usually don't have a big appetite and constantly feel hungry might have an incretin hormone deficiency. This hormone helps reduce sugar release from the liver after meals. A deficit in this hormone can cause rapid hunger, leading to elevated blood sugar levels. The 13th sign is excess abdominal fat. This common symptom of high blood sugar impedes the conversion of food into energy that can fuel your cells, intensifying hunger. The 14th sign points to issues with the nervous system. Elevated blood sugar levels can damage blood vessels supplying oxygen and nutrients to nerve cells, resulting in neurological complications. The 15th sign involves changes in the skin. If you observe skin color changes and growths, it could be indicative of high blood sugar levels. Additionally, you might notice the appearance of dark, thick patches on the neck and arms. The 16th sign is characterized by tingling sensations and loss of sensitivity, resulting from nerve damage. If you experience numbness or tingling in specific body areas, it could indicate high blood sugar levels, a condition known as neuropathy. At this stage, you've learned about various signs pointing to high blood sugar levels. Nowadays, individuals with diabetes can lead normal lives, work, and engage in sports. Modern medicine provides necessary tools to make the life of a diabetes patient comparable to that of a healthy individual. However, timely detection of the condition, constant monitoring of blood sugar levels, and adherence to all medical recommendations are crucial. The goal of diabetes treatment is achieving compensation, including maintaining blood glucose levels within the normal range. This state promotes the normalization of carbohydrate metabolism and enhances indicators of lipid, protein, and electrolyte metabolism. Diabetes treatment is multifaceted, including adhering to a specialized diet, taking medications, and maintaining the necessary level of physical activity. If you found this video informative and useful, we invite you to subscribe to the channel for interesting content on health, proper nutrition, and well-being. And don't forget to hit the share button to tell your friends about it. This was the Health in Your Hands channel.